Welcome back. This is Dr. Duncan. As I told you, this is going to be one of the best experiences you're going to have as far as getting your pain away, taking out your pain away. And so at this point, actually, I'm going to want to explain exactly what's going to happen in your first visit. I know when you came in the front, you found the young ladies, they gave you some paperwork to fill in. Now, after you fill the paperwork, what is going to happen is that I'm going to come and we're going to go through the exam. Basically meaning that we're going to go through all the paperwork that you have filled in. If there are some questions I need to ask you, we'll talk about it. If there are some areas that you have questions that you didn't fill, or you have questions filling those issues, you're gonna ask me those things, and that's gonna be the first step that we're gonna start as far as your care. When we have met and talked about your paperwork, then if I feel like you need X-rays, I'm gonna have one of our staff who are well trained to do X-rays. They're gonna take you and do the X-rays. Now, why is X-rays very important? X-rays is kind of like gives me an idea of seeing inside your spine or inside your body to see the spine, and that gives me an idea of how and what is going on and what is causing the pain. Because I always tell my patients that if you have a pain, there's always a reason why the pain is. So when I shoot the X-rays, before I even do a lot of touching and finding out what on earth is going on and moving anything, it gives me an idea of what is causing the pain. And so after we do those X-rays, what happens is then we're gonna put you into a room. And then when we put you into a room, before I come to see you again, I will have looked at those X-rays and I will have known what is going on. So when I come to the room, I will do several, exams. We'll do the exam. And then after the exam, if I find that you really need care that day, then we'll do the treatment. So the question is simple. When you come to the office, do you get treatment the first day you come in? And the answer is yes. It's only if there's something like you have had a fracture or you have had a broken bones or something like that that could cause us not to treat you. But remember, the first visit becomes very important because it gives me an idea of knowing how we're going to take care of you. And so after the first visit, I always recommend all of you, if you are being in pain, use some ice. And the reason is because your muscles might be a little sore. I don't see that all the time, but sometimes you'll find some muscles might be sore. And so I always recommend people to use ice. Or even they can buy the BioFreeze actually. The first visit, you can buy the BioFreeze. We keep this in 3 different forms. You can have a spray as a BioFreeze, you can have a cream as a BioFreeze, or you can even have something that we call it as a spray. So we have 3 different options. So I would recommend you, if this is your first visit, you've been having a lot of soreness, I would recommend you to get one of these products. It's called BioFreeze, the first visit. Now, when you have gotten the treatment for the first visit, I always tell my patients, I want to see you a little close treatment. And the reason is because I'm trying to learn your body as I treat you. I'm listening to what is the response for the first visit. And so a lot of people wonder, do I have to come the next day or this? And I always recommend my patients, I want to see you a little close because I want to make sure that I give you the best care that you can get, because I know if I do the right thing, you're gonna be happy. And so my job as a doctor is to make sure that I get you out of pain, and that's why a lot of people come to see us, because they want the pain away. And that's one of the things that I want to make sure you understand. And so if you have any question, or if there's anything that you don't understand when you're coming to us, or let's say you got alignment the first day and the next day you might wake up a little sore and you don't know. So all you have to do is just let me know you got a little sore, and I'll explain how we're going to make sure that we kind of adjust your treatments. Now, just remember this, being your first visit, there are a lot of ways to adjust. And so the first visit, I might do a little manual adjustments, or I might even use activator, which is this little instrument. I might use an instrument to adjust you. But I want you to understand that it doesn't matter which method I use, but I want to make sure you understand that the long-term goal will be to get you out of pain. And that's why sometimes, depending on how much pain you are in, I might decide to use less invasive treatments, which I can use by using the activator. Or if I feel like you don't need this kind of treatment or this kind of method, we can definitely work with you to make sure that we give you the right kind of treatment that is going to get you better. And so I want to welcome you. Please, thank you for coming to see us. This is your first visit. I want to make sure that I know a lot of you are in pain, you are taking a lot of medications, and that's okay, I understand. I just want to make sure you give us time, because some of these conditions have been going on for so long. I mean, for so many years. And I always tell my patients, in the next couple weeks, by 3 weeks, we should know that you are getting better. You should even tell me, you should be in a place where you can tell me, Doc, I feel better, because I know this works. Chiropractic works, and that's why I have passion for it, and that's why I know that we should be able to help you. Just be open-minded, just converse, talk to me. When there are things that you need to ask, don't keep anything. If your friend tells you something against chiropractic, just talk to me about it, because I want to be that doctor who is just not a doctor, but more of a friend, because I know when you're in pain, your family is not happy. When you're in pain, everybody, your friends are not, you are not able to communicate with them well. When you are in pain, you are suffering, you are depressed. But I want to be that doctor that is going to make sure that your life, imagining even your mental status, if you are depressed, I want to make sure that I can put your morale up so that you can feel better. And even those who are around you can feel better. It even can be like, oh, I want to go and see your doctor. Definitely, that's what we are looking for. Otherwise, have a wonderful day, and we welcome you to Chiropractic Works. And I know that in the next few weeks, you're going to be coming to tell me how great you have been feeling and how great these treatments has been helping you. Otherwise, please, if there's any question, don't forget our phone number is 248-398-1650. If you have any question, or if you want to send your friends and your relatives to come to see us, as we have seen, every day we are growing and growing and growing. Why? Because we are trying to help people, and we do it the right way. We do it the right way. So please give us a call, call us, let your friends call us. Our number is 248-398-1650. Once again, Dr. Duncan, welcome to our office. Thank you.